Okay. Which of the following is the most likely cause of the patient's symptoms? Acute asthma exacerbation, airway foreign body, bronchiolitis, pneumonia, or a pneumothorax. This is a 4-year-old girl brought to the emergency department by her mother after she started coughing and wheezing during a family picnic. The mother reports that her daughter was eating grapes at the time. On physical exam, she's in mild respiratory distress with diffuse wheezing and oxygen saturation of 94%. An X-ray shows hyperinflation of the left lung with mediastinal shift to the right. Um, I mean, so she's definitely in distress. She's got a mildly low oxygen saturation for a 4-year-old. Um, she's eating the grapes, which I could think would very likely get lodged in there. I think that's the one that kind of makes the whole picture make sense. So I'm gonna go with airway foreign body.
Yeah. So if you work through it, it's an acute issue, right? They give you kind of the history, right, of eating grapes, right? Key thing here that I want to note for you so that you can kind of keep in the back of your mind, right? Usually, right? I guess my question for you usually is if someone chokes on something, which side is it going to usually go to?
Usually goes on the right.
Yeah, right. And the reason why it goes on the right is because well, if I can draw real quick. Okay, so when you have your trachea, right? Let's say this is the left and this is the right, right? What do you call the split? What is this area called? Yeah, your carina, right? So actually your right side is a little bit more vertical. So when same thing when you intubate somebody and you accidentally go too deep, it's gonna kind of want to go this way because of the angle is not as, intense, right? This angle versus this angle. So yeah, you usually go to the right, just on a note to remember kind of for your test. Sometimes they'll ask you like, oh, where did the foreign body go? So then you're gonna be like mainly the right main bronchus. But it doesn't fit anything else. Acute asthma exacerbation, right? Usually it's not going to just be one side that's hyperinflated, right? Versus another side, right? Bronchiolitis, right? Not infected, virus, pneumonia, right? No fevers, right? No consolidation, no interstitial markings, right? And then pneumothorax. Some people, if you get so stuck up on this mediastinal shift, then you might be like, oh, it's a pneumothorax, right? But it doesn't fit with the clinical picture. So you got to make sure, right? You got to make sure that you fit everything together. So
Yeah.
good.